Now it's time to look at recreational drugs. This is a pretty broad topic, so I'll have to break this up in a few more videos than normal to properly cover it. Let's start with the definition. What are recreational drugs? Recreational drugs are drugs that are taken for enjoyment, not for medicinal or treatment purposes. Now, that's not an overly helpful definition because sometimes people will take recreational drugs to help with medical issues like pain or anxiety. An addiction is definitely a medical condition, along with all the mental health issues that come along with it. So for the purposes of this lesson, I'm going to call recreational drugs street drugs. Drugs that you get from your friendly neighborhood drug dealer, or drugs that are most commonly taken for personal use, like marijuana and alcohol. Alright, so now that that's settled, let's talk about narcotics. We've covered them as a toxidrome last week, so we should be pretty familiar with what the signs and symptoms are. Narcotics are like big CNS depressants, so altered LOC, decreased respiratory drive, heart rate, gut mobility, and pinpoint pupils all come along with narcotics. Narcotics are made naturally and synthetically. They're also called opiates because naturally they come from the opium plant. Historically used to treat pain, anxiety, or just as a general high, they've become a very potent drug for treating a variety of pain, and also the leading street drug of choice, and the most overdosed drug worldwide. Narcotics work by affecting opioid receptors, which can be found in the peripheral and central nerves throughout the body. There are a load of different classifications of opioid receptors, and each one has slightly different effects. That's why we have different opioids, to elicit those different effects by affecting particular receptors. But the general effects of all of them are euphoria and analgesia. The euphoria is caused by releasing dopamine into the mesolimbic system, a portion of your prefrontal cortex, amygdala, and nucleus accumbens. It's basically the reward pathway in our brains and speaks to why these drugs can be so addictive. The analgesia is caused by blocking transmission from peripheral nerves to the spinal cord and to the brain at various points. So how do you treat a patient on narcotics? Narcan. It's a great drug. It's competitive with narcotics for the opioid receptors, and when it gets in there, it blocks them, but it doesn't activate them. So it's basically causing the narcotics to float around until they get metabolized away. An important point about Narcan, while it does work great, narcotics are getting stronger and stronger with the advent of synthetic narcotics like fentanyl and carfentanil. So one dose of Narcan is not always going to be enough. Oftentimes, it'll take multiple doses of IV Narcan to wake up the patient. The other thing worth noting about Narcan is that it only works on opioids. So if your patient is taking a narcotic and a sleeping pill, the narcotic will get rid of those effects from the narcotic, but it may not affect the sleeping pill. So make sure you have a good history and an assessment so you can manage your expectation on how effective this Narcan is going to be. So just to recap, narcotic overdose, CNS depression with pinpoint pupils. They're going to get 0.4 milligrams of Narcan, and that's going to be titrated to effect. Usually we want the patient to wake up enough to manage their own airway, breathe again, but not wake up being combative. Like I said before, it might take a few doses. In the meantime, make sure you manage the airway appropriately. We don't want to cause an anoxic brain injury or permanent brain damage in our patient, all because we were waiting for that first dose of Narcan to work.